Hello everyone, welcome to my YouTube channel. This is Dr. Sankari Kasi and I am a family medicine board certified physician. Today we will review an important topic which is low iron or iron deficiency or iron deficiency anemia. This is very common. I see that in patients starting from infants up to patients of elderly ages, and it is very important to replace them. And today we'll discuss about how do we diagnose this low iron and what are the things that you can do and what are the things you cannot do and how can we overcome this low iron. So why iron is so important? So iron is helpful in building up the red blood cells, and then these red blood cells are the ones that carry the oxygenation to the different cells of the body. So when our iron level is low, so that the oxygenation content in our cells is very less, and that's why a lot of patients, they feel very tired, they also feel very fatigued, lightheaded, dizzy, and patients with a low ferritin also have a large amount of hair fall. So let's start with the infants. So babies who are born with a low birth weight, or the babies who are born before the 37 weeks of gestational age, which is the low birth weight babies, they need to be supplemented with iron starting at 2 weeks of age until 12 months of age. So when you take your infants to the healthcare provider, make sure you talk about the iron supplementation. Other babies who are the regular term babies, after 4 months of breastfeeding, when they start the solid food, make sure to assess them whether they have any signs of iron deficiency, or if their nutrition is not providing them the adequate amount of iron, then we also supplement them with the iron. And what are all the other common causes and who we see more commonly iron deficiency? The number one is nutrition deficiency. If they are taking less amount of iron in the diet, and that's how I see them, nutritional deficiency with a low iron. The second is especially women who are having heavy amount of menstrual bleeding. I also see them with the iron deficiency anemia. And also in pregnancy, there is a huge demand, and then that's the reason we see them the iron deficiency anemia. And some patients, if they have other problems such as ulcers or there are any bleeding problems where there is a blood loss, there also we see them with the iron deficiency. So let's see how do we diagnose iron deficiency. The first one we do is we order a complete panel of blood tests, which is complete blood count, iron and ferritin studies, as well as TIBC, which is the total iron binding capacity. If the patient's hemoglobin is low, then we know them they have anemia. They may have low hemoglobin, or they may have low iron or low ferritin. But when we see any of them with a low iron or low ferritin, we always ask them to take more iron-rich food or the iron supplement. So always the best way is to supplement by increasing the iron content in your diet. Make sure that you eat a lot of fresh fruits and green leafy vegetables, anything which has got a darker green vegetable which has got the highest amount of iron content. So the meat products also has iron, which is called as the heme form of iron, which is very well absorbed. So the non-heme form of the iron is present in the plant-based diet, and that is not very well absorbed. And that's why patients with a vegetarian diet, I see them, they commonly has iron deficiency anemia, or they may have low iron in their blood system. So what do we do to improve this absorption of the iron? The first point is make sure that you have to take it along with some vitamin C. So when you're taking iron-rich food, make sure that you take something which is citrus or fresh fruits or vegetables along with that, which has got the highest amount of vitamin C, so that your iron is very well absorbed. The first step is the vitamin C, and then the second tip here is make sure that if you are taking iron, you should not be taking any antacids, which is the acid lowering medications, within 2 hours before eating this iron. And also make sure you do not take any coffee, tea or milk products or calcium supplements along with the iron, because that can also delay or decrease the absorption of the iron. So any of the antacids, calcium supplements, coffee, milk or tea, you have to take it 2 hours before your iron rich diet. So these are the 2 steps to improve your iron content and absorption in the blood system. The third step is, and also if you are taking iron supplement, you have to take it every other day. So that's the most important tip. So patients do ask me, why do we have to take it every other day instead of every day? What happens is when you take iron supplement, so it's called hepcidin, which is one of the thing which is produced by the liver and which helps in the metabolism of the iron. So when you take iron, the hepcidin level increases and that delays the absorption of the iron. So instead of taking it every day, you have to take the iron supplements every other day. So make sure to remember these 3 steps when you are taking iron rich diet. Some of my other patients also, they try juicing because if they don't want to take iron supplements along with the diet, they also do a lot of juicing with a lot of green leafy vegetables, and they also drink the whole juice, and that can also improve a lot amount of their iron content. That you can definitely try that. Other common questions some of the patients they ask me is like about the iron supplements, what to take and what not to take. So the iron supplements available in the market is ferrous sulfate or ferrous gluconate. They are over the counter, you can take them, but I would recommend you to talk to your healthcare provider regarding what is the right form of iron and how much of iron supplement that you have to take. So iron, all the iron supplements, a lot of side effects could also be a potential reason like why some of the patients they don't want to continue iron. Some of them they cause nausea, bloating, constipation, and because they are constipated, their acid reflux symptoms can also get worse. If that's the case, make sure you can take a lower form of the iron. For example, if they have higher concentration of the iron, they have more side effects. So make sure to get those over-the-counter products with a lower dose of iron and talk to your healthcare provider if that's something a right choice for you, and that can also lower your side effects. And then if you take it every other day and you take it along with some vitamin C, that'll help you to improve the absorption of the iron in your system. And then when can you get it retested? And that's an important question a lot of us ask us. So even though all the materials or the research articles would say that have it tested for 4 weeks, I usually check it after 2 months to make sure to recheck your hemoglobin, iron and ferritin to see if the trend or the levels are rising up. If the levels are rising up, then we are on the right treatment, then you can just continue with that. And if your iron and ferritin is not going up, even though you have been taking the supplements the right way, the right amount, you have been taking the iron rich diet, then talk to your healthcare provider, because we do have iron infusions that they could prescribe that for you. And also we can add other labs to find out if there are any malabsorption problems or gut issues so that you are not able to absorb the iron. I hope you like this video, and make sure to leave a comments if you have tried any of the supplements or the diet that has helped to improve your iron. And then also make sure to subscribe to my channel if you have not subscribed that. And thank you for watching. I hope to see you soon in my next video.